We are at Chelsea Hospital with Dr. Andy Moore, an orthopedic surgeon, and welcome back. This is your second tour of duty at Chelsea?
Yeah. Well, it's good to be back. I've been around Chelsea since, I guess initially around 2012 or 2013. I even came here when I was in training in 2005, before all this was built. But I've been around a little bit, and I'm happy to be back with one of my previous partners asked me to join her in practice here in Chelsea last year, and it's been great. It's been working very well. I'm very happy to be back in Chelsea.
Orthopedics is a growing specialty here at Chelsea Hospital, and you have a focus in your practice on ankles and feet.
Yes. Yeah, I did my general orthopedic surgery, and about halfway through I decided that I wanted to specialize within orthopedics, which has gotten to be pretty common these days as the field has evolved and the procedures have gotten to be so specialized. So I did a fellowship in foot and ankle surgery in New York after I finished in Ann Arbor here at U of M. And then I've been an orthopedic surgeon, mostly doing foot and ankle surgery for now about 14 years.
You don't hear too much about ankle replacement like you do with hip and knee. There aren't any off-the-shelf parts for ankle replacements, are there?
Well, there sure are. There's been a huge evolution in that. You know, when I first started, the field has been looking at doing ankle replacements for 20 or 30 years, and we really just didn't have a lot of success in terms of longevity. The components would fail pretty quickly, and patients would end up having to have their ankle fused. And the engineers in the field just sort of evolved like anything else. And about, I would say, 10 or 15 years ago, we got sort of what we call the fourth generation total ankle replacements, and that was right about the time that I was coming through my training. So in my early days as a resident, we didn't really ever do ankle replacements. By the time I was doing a fellowship, the newer models were coming out, and I've seen it evolve in the 15 years since then. And for the right patients, ankle replacements are actually becoming the main treatment for surgery, for ankle arthritis, unless there's a reason that we can't do an ankle replacement, which sometimes there is. They're still not as commonly done as knee and hip replacements, and that's partly because ankle arthritis isn't as common. But if you do have ankle arthritis, it can be absolutely debilitating. It's, in my experience, even probably worse in terms of being able to walk or get across a parking lot or do much in terms of quality of life compared to even knee and hip arthritis. So ankle fusions are still a viable option, but for a lot of patients, being able to retain some motion at their ankle joint with a surgery that eliminates their pain or minimizes their pain, but then allows them to still have some ankle motion. And we're seeing the longevity improve so much that it really has become sort of mainstream, maybe in the last 5 or 10 years.
What are you seeing the cause for ankle and foot issues that you're seeing in your practice?
Well, you know, injuries are a big part of it, and then arthritis is a big part of it. And it's the two kind of things that plague humans in our musculoskeletal systems. We get an injury, and sometimes the injury heals, and we don't think much of it, and then 20 years later, it starts to develop problems. We see some of that, or a lot of that. And then the other thing is, I used to joke, too many trips around the sun. You know, just we get older, and joints wear out. That sort of become a very common source of pain. And the answers are not always surgical, but there is some form of management. And one thing that is nice about it is that, you know, if you have arthritis of your middle of your foot or of your ankle or somewhere other, a toe or that kind of thing, you're not the only one. There's a lot of people, and there's been really a growing field of knowledge on how to manage these conditions well.
How about athletes? I picture overuse by like runners as an example.
Overuse or even injuries that occur in the setting of someone who is very active have to be kind of thought of in that context. Running, and for instance, runners, the act of running without an injury doesn't seem to cause any premature wear or issues, but it does cause sometimes ailments, I would say, pain, things that are self-limited, except that we have to give them time to recover, and that can be very difficult if you're a runner and you're trying to keep your mileage up, or your endurance, or it's just a big part of of what you do, slowing down your level of activity can be hard. And our job is to find strategies so that you can sort of balance both things. You can still run, or you can still exercise the way that you want while you're waiting for that injury to improve, and at least give you some information about what's causing it, and how to kind of move on with your life without having to stop everything for 3 or 4 months.
You think about like Aaron Rodgers or Kirk Cousins, it's just, they're out. They're just done for the whole year.
One of the issues in the high-level athletes in high demand is that they don't do very well until they're about 100%. And you really have to get to that 100%. And there's this idea that I have found that a lot of injuries can recover, or even surgeries can recover in 2 or 3 months to about 50 or 60%. And that does your day-to-day. But to get to that 90%, you spend, the first 3 months getting to a reasonable level, maybe 60% of your recovery. That last 40% is going to take you another year.
Wow.
And that's why these athletes miss a whole season or a whole year after these injuries.
Are there things you can do to avoid problems with your ankles and feet?
Absolutely. Footwear is a huge part of it. And footwear in terms of ankle support, the motion control, and then having appropriate footwear for whatever activity that you're doing is important. There's been, and what works for one patient isn't always what works for everyone else. For instance, some athletes do well with minimalist footwear. Some athletes need more support. It depends on the type of foot they have and really how they've been training. But that's a big part of avoidance of injury. And then the other thing is understanding issues like fatigue. For instance, turning your ankle, spraining your ankle. A lot of times that can happen because you've gotten fatigued, you've gotten tired. And so we used to tell people, do your conditioning, do your conditioning after your endurance, but certainly don't do it before. And because if you're fatigued and tired, you're more likely to turn your ankle because your muscles become tired and fatigued. So that's true whether it's an ankle or a foot or whether it's a knee. But there's, that's why a lot of these high-level athletes and teams have trainers that help kind of manage the risks that are associated with playing sports.
Does lifestyle impact your ankle and foot health?
For sure. Not only the consistency of your exercise, but things like managing weight make a big difference. We found that we are humans, we walk on 2 feet, and in order to stay balanced, we need muscle contraction, otherwise we fall down. What that does, though, unfortunately, is amplify the weight that we have above the ankle joint. So we see patients who will get into their middle ages or a little bit later in life, and if they gain 20 or 30 pounds, that 20 or 30 pounds unfortunately gets amplified. And if it's 100 pounds, it still gets amplified. And so you can take an ankle that wasn't bothering you when you were younger, and it's not particularly arthritic, or a midfoot or what have you, and because of this multiplying effect that we have with muscle contraction, that it can become a problem. But the upside to it is that, I tell patients this, sometimes they come in with pain and they're not really looking for surgery, but they're looking to sort of manage that pain and minimize it. Say, well, sometimes just a modest 5 or 10 pounds off your ankle, just that is something you'll be able to tell a difference.
Really?
And it'll cut down your need for taking medications, and it can really make a big difference. And that's, again, because of that multiplying effect.
So like diabetes, that has a big effect on feet. Does that cause issues that you end up seeing?
Sure does. Diabetes has a very specific thing that it does, which is it tends to cause the longer nerves of the body to stop working. And that it occurs in proportion to the length of the nerve, so the longest nerves of our body go to our feet and our toes. Well, what happens is we start to lose sensation and even a little bit of motor function in our feet and our toes over time with diabetes, particularly if it's not well controlled. And then we lose the ability to protect our feet. So our feet can develop shapes that are different because of the muscle changes or because of other reasons, but those shapes can cause pressure points. And without protective sensation, pressure points turn into pressure ulcers, and ulcers turn into infections. And it's not usually a blood supply problem, it's usually a nerve problem with diabetics. And so we spend a lot of our time managing issues. We like to manage them before there's an infection or an ulcer. That's the prevention is some of the most important part.
I know people that have foot pain even when they're sleeping, just laying there,
Yeah.
and they're not, putting pressure on it. Are there things that can be done for people like that?
Yes, the most non-weight bearing pain, if it doesn't occur during weight bearing, is in a category that we'll say sometimes is neurogenic pain, or is pain from nerves, and that can be peripheral neuropathy. It can be a compression of a nerve. Most of the time, those problems can be managed with medications and nutrition to kind of minimize the symptoms. Sometimes pain at rest or at night is actually mechanical. It's just that there's another phenomenon that when we sleep, our brain's quiet. The sensory inputs into our brains decrease. And so during the day, we're walking around, it feels fine, but that inflammation starts to build, and then we go to sleep at night. Because it's become more inflamed and now there's no other inputs to the brain, you notice that your foot hurts. And that's actually mechanical in a lot of cases. But it just happens to bother you at night. We even see that after surgery, where patients have sort of a soreness from their surgery, but it doesn't really bother them until they try to sleep, and then they have a hard time getting to sleep at night because of that. So a lot of times, a surgeon or a doctor who's tuned into those different sources of pain can help develop a strategy to really kind of minimize the pain that's keeping them up at night.
How does someone know that they have something that could be treated versus just giving up and going to the scooter and dealing with it?
I think seeking medical evaluation is very helpful. And I think that some patients are reluctant to see, particularly an orthopedic foot and ankle surgeon, because they think, well, I don't want any surgery for this. But what they don't realize is that most of the time, what I do especially, isn't surgical. Most of what I do is advice and information, and surgery is just one of many options. So I think that that if you're having a pain that's affecting your quality of life, and it's been going on for some time, I think you should see a physician, and particularly an orthopedic foot and ankle physician who has the knowledge and expertise and the focus in that area to be able to give you meaningful and useful advice.
Yeah, it sounds like that would be a hesitation. The foot, the ankle, it's a lot more complicated than the knee, isn't it? The number of bones and
certainly it's different. They all have their own issues, and the way knees move and what causes pain in knees is still somewhat challenging from a physician, but there's certainly not as many moving parts in a knee as there are in the foot and ankle. With the 28 bones that we have, and plus additional sesamoid bones, different foot shapes, and then a history of your life. What kind of injuries you've had, how long have you been on your foot, what's your weight been your whole life. That affects how your feet work and what hurts. So the foot can be challenging, and one of the reasons I went into foot and ankle surgery when I was in orthopedic surgery in the context of that was I felt that foot and ankles hadn't been really worked out yet as humans. It was sort of the last frontier in orthopedic surgery because it was so complicated, and our treatments just hadn't developed yet.
People that don't wear the right size shoes, and I think there are there are people that would like to have shoes that are smaller than they should actually be wearing, and vice versa. It sounds like it could have a pretty serious impact.
Certainly, and our feet get larger during our adulthood, usually by a half a size. Certainly, our bones don't grow, but our ligaments stretch a little bit. And when that happens, generally, you have to pay attention to your shoe size. And so, what you wore when you were 22 may not work so well when you're 62. And there is a tendency for us to undersize our shoes, or to wear shoes with too high a heel, or a toe box that doesn't look like the front of our feet. We've all seen toes that come to a point, but we haven't seen a lot of feet that look like that.
Yeah. So if people have a question, they have a concern, if it's bothering them, that's the reason they should come see you.
Yes. Yeah, and we take, we try to be very accommodating to patients, and not, we can usually see a lot of patients without a specific referral, and if we need a referral, we can help them with that. But sometimes we can save them a step of having to go through the primary care office, although we certainly love to have referrals from primary care physicians. But we can also just be reached directly through our office, and an appointment's can be made for me to evaluate patients and give them advice and offer whatever solutions we have.
Great. So foot pain, there could be a solution, and it probably starts with a call to see what options there are. Thanks for spending time with us today.
Well, thank you for having me.
Dr. Andy Moore, orthopedic surgeon at Chelsea Hospital.